Something. Okay, hello everyone. Today is part 2 of the Katie Beckett presentation. We will be going over the position forms, how they should be filled out, what it should say, what it looks like. If you have not seen part 1 yet, it is available on the website under webinars. The website is shineautism.org. So I'll start the presentation now. Am I still presenting?
Yes.
Now it's not moving.
Uh-oh.
I'm sure you guys can hear my children in the background because they opened the door. Present again. Okay.
There we go.
All right. And let me close the door real quick. So today's webinar, we are getting information from Ms. Stephanie Carroll. She is a parent that has been participating in Shine events since day one, and she has a lot of knowledge with the Katie Beckett application process. So she is here to share that knowledge with you. A lot of people are intimidated by the information and the amount of paperwork it takes to get this process going. So we're trying to ease your anxiety so you can get it done yourself and save you some money. Wrong computer. So at Shine, our mission statement is to make sure that the youth and children and parents are empowered and not affected by the word autism. We want you to feel comfortable in where you are and just be happy and enjoy the moment with your children or child. I'm Christina McCullough. I'm the founder of Shine. I have twin 7-year-olds on the spectrum, and our journey wasn't so nice. So I wanted to create a organization that really was very nurturing to their disability and to highlight them and all of the children. These are my twins, Sage and Saint. And I want you to think about why you're here today, which is for the Katie Beckett Waiver webinar, but deep down it comes to money. Everything is not affordable. Therapy is expensive. Insurance companies are a pain to work with, so we need a solution, which is why you're here today. This information, we are not medically or legally certified to give you legal advice. So if you need anything of that caliber, seek a lawyer or a medical professional, your child's pediatrician or doctor. Stephanie, you want to take it away?
Sure. So, hello everyone. So this little human here is my wife. So my son Cairo is now 3 years old. He was diagnosed with autism when he was about 17 and a half months old. So we've been on this journey for over a year or two now. And so as many of you, when your child is first diagnosed, you're like, okay, what next? How am I going to do all of this? How am I going to do all these therapies and still live and work and all this? So after much research, I came across Katie Beckett, completed application, was approved the first time. And so I really feel like it is my duty to educate other parents about this resource that Georgia has. There are people who charge, who charge families to complete the application, but it really is doable. You can save yourself $1,500 and, buy something nice, go on vacation, and still be able to get approved for Katie Beckett. So in partnership with Shine, we have started a 3-part series approach to the Katie Beckett review. And so Katie Beckett application process, which I'm sure some of you have heard, or if you've been working through your application since we last met, it can be very long. And unfortunately, I cannot cover everything, in a single webinar. So we're breaking it apart. So previously I discussed eligibility, what is needed to apply, coverage information, and today for part 2, I will review the forms that you will need to provide your child physician to complete. Next slide, please. Sorry, next slide. So this is similar slides to what we talked about before. I know that Delancey didn't join originally, so I just want to share a little snippet of what Katie Beckett is. So Katie Beckett Waiver is a Medicaid waiver program, also known as TEFRA, and it was originally created after a 3-year-old girl named Katie Beckett was in the hospital, and she was unable to go home after contracting a brain infection. She was in a coma, and she was paralyzed, and her parents wanted to take her home. But Medicaid would only pay for her care as long as the little girl was in the hospital. So the family fought very hard, and this was during Reagan's time, Ronald Reagan's presidency time. And so it went to Congress even, and so the Medicaid ended up changing the rules, and the government allowed exceptions in states so that parents like the Becketts who made too much money to qualify for Medicaid, their child would still be able to be covered for high medical costs at home. So today, Katie Beckett is currently offered in Georgia, other states, Maine, Nebraska, Oklahoma, like the West, Midwest area. And states actually, I learned this recently, states actually have an option to opt in and out of this program. So it's available, but there is federal funding, but the state has to want to participate. So essentially, the Katie Beckett program extends Medicaid benefits to children who would have only been eligible if they were in an institution or hospitalized. But now children 18 or younger who live at home and are not eligible for Social Security because of parents' income and resources, they now have access to get Medicaid. Okay, next slide. I think I'm trying. So part 2, I want to share the most recent versions of the forms. Let me get the link. And I do have 3 screens, so I do apologize if it looks like my eyes are all over. Okay, where is the chat? Oh, here it is. I'm going to paste it here in the chat, so if you want, you can follow along. These are the 4 forms that you would, print off and fill out your portion for and give it to your child's physician to complete. This is a part of the packet. Because you have to wait on the physician to complete or sign these forms, these do take some time. Some doctors are familiar with these forms and willing to complete them, and some doctors have no idea what it is and don't have any experience. And when they fill it out, they can have some mistakes that will definitely result in your child being denied. So whether your physician will fill it out or they'll allow you to fill it out and they'll review and sign them. You'll have to really have that discussion with them and say, hey, doc, I'm really trying to get this for my child. Can we work together to complete these forms accurately? Most families will have their child's pediatrician fill out the forms. It can also be filled out by specialists like neurologists, cardiologists, psychiatrists. It has to be a physician, so it must be an MD or DO. It cannot be a therapist, cannot be a BCBA, cannot be a psychologist that fills out these particular 4 forms. Next page, please. Okay, so I don't know if you can really see the screen, but I did send the link. So this is DMA 6. This is one out of the four forms. You can follow along. So again, this can be filled out by a pediatrician, neurologist, cardiologist, developmental pediatrician, or any physician, MD, DO, who has authoritative knowledge of your child's condition. So I want to highlight dates. So on line, let me pull up my lines here so I can tell you exactly what line. It's very important to not date these forms until you are ready to hand deliver it or mail it off. So when you are filling these out or giving it to your physician to fill out, cover the spaces with a Post-it note saying do not date or please leave blank so that the doctor does not put a date on it. Everything with Katie Beckett has to be dated within like a 3-month, 90-day period. And sometimes this can take a long time to get back. So you want to be the one to be the final person to just put the date on it, just in case it takes a long time for you to get your other documents. So on this is page 1 of 2. So the applicant's name will be your child. So the child's name, demographics, box 2, Medicaid number. As you see, I put new application. You enter the child's social security, age, birthday. For box number 7, for the for being institutionalized, you would hit yes. So what this is saying is that if your son or daughter or whoever your loved one is was not at home, would they be in an institution? So in my last session, I mentioned that many of our children, up until recently, if they had a diagnosis of a developmental delay or autism, they went to an institution to be cared for. So what we're telling Medicaid here is, in our opinion, as their caregiver, if they were not home or they were not able to receive community like speech, OT, ABA, that they would have to be in an institution. So this is what that question is asking. And then number 8, does your child attend school? You could put yes, daycare. You don't have to put the name of the school. And then number 9, again, date. Anything that says date, do not fill out until you're ready to put it in the mailbox or to hand deliver it. So that's same for number 11, date. Yeah. So for most children applying for Katie Beckett, for the history on box 12 I'm looking at, for most children applying for it, you will most likely have more history than the space permit. So as you can see on my application, I put please see attachment, and this is appropriate to do. An attachment, and I'll show you an example of the attachment that I typed up, and you could take a picture of it. You could use it if you want. But you could just see please see attachment. For box 13, for the diagnosis, you will need to refer mostly to your doctor's notes, visits, or because ICD-10 codes, these are searchable on Google, but if you're not familiar with it, you could just put in your child's top 3 diagnosis. So for my child was autism, apraxia, global developmental delay, and a quick Google search will show you the ICD-10 codes to fill those out. Let's see what else I want to point out. The number one diagnosis should be the strongest or the most severe diagnosis for your child. Just for like a suggestion to do that. Let's see. Medications. So for medications, if your child, even from prescription medications to over-the-counter medications to even simple vitamins or melatonin, this should be listed here. So remember, you're trying to tell Medicaid, hey, we need these additional resources of Katie Beckett. So you really need to list it as in the most severe case, if that makes sense. So again, I put please see attachment because everything could not fit there. Let's see what else. Please feel free to interrupt and come off mic if you have any questions as I'm going through. So 15, same box 15. So this would be like, did your child do any lab work? Did they do any imaging studies? Did they do they get any like inhaled nebulizer treatments, stuff like that? That would go there. Now, your physician would fill this out, but if they may not be very familiar with your child, you can fill this out and let them review it. And if they do not agree with it, they can change it. Okay, let's see. I can't see box number. I think that's it that I wanted to point out there. Any questions about DMA 6?
Do you want to go to the other side of the form?
Page 2, right?
Yeah.
Yeah, we can go on page 2. Let's see. Okay, let me see my screen. And I have to follow. Okay, so page 2, this part is most likely going to be where it's going to be a collaboration between you and your child's physician. So nutrition, bowel, any nutritional challenges, is your child a slow eater, or have any of these dietary restrictions? Do they have any bowel challenges? Are they potty trained? If they're too young to be potty trained, then you would check age-dependent incontinence. So the rest of this may be more appropriate for your physician to fill out. Behavior status, this is something that you can actually fill out because you know how your child is at home. Let's see what else. Oh, therapy visit 37. 37 is very important for you to check. So this indicates how many, the number of therapy that your child is currently receiving per week. So if your child gets ABA every day, that is more than 4. It's ABA, so it's based on daily amount of therapies, not the type of therapy. Let's see. So 39, 5 days a week of therapy. So number 40, box 40, remarks. So the last session, we talked about the psychological evaluation that is needed, and it needs to be up to date in order, to complete with the packet. So in the psychological evaluation, there's scoring systems that the psychologist does. And so in this box is where you would put parent or caregiver, you would put the score based on what the psychologist said. So you would just read through it and look for this score, the CARS2 score. And then you can, like how I put C attached psychological evaluation for assessment, you would attach that to your packet. And again, date, do not touch the date. And that is it for DMA 6. Do you have any questions about this DMA 6 form? Can you all let in my AI to record notes?
I did it.
Okay.
She already did. Thanks.
Oh, okay. Oh, that's fancy.
I was gonna put that. I'm like, wow.
Okay.
I hired a good marketing coordinator. She has all kinds of ideas, young folks these days.
So okay, next slide, please, Christina. So I mentioned the attachment that, throughout the form, please see attachment because everything cannot fit in the boxes. So let me go to my page. So this is basically a Word document that I typed up. And it showed based on like the box number. So like box number 13, I listed all of my child's diagnosis codes. Every single thing that any doctor, any provider has ever told me that my son may have had or gone through, I listed it here. Because again, we're painting a realistic picture for the person reading our packet that this is what our child has. These are some of the challenges our child may face. So, and scroll down, please. And then box 14. So all the medications that he's ever taken, ever been prescribed, even if he's not on it currently, I've listed that there. Number 15 is any diagnostic testing that your child has ever had. You list that there. If they've had any procedures, surgeries, hospitalizations, you could also list it here. So this is basically me breaking down everything from DMA 6 to a more concise method so that the person reading our packet was able to see exactly, his medical diagnosis, medications. The rehabilitative services, this is taken from, and we'll look at the medical necessity in a moment. But this is basically taken from all the prescribed therapies that was recommended for my child. And I don't know if you see on the bottom, I put asterisk saying these therapies were recommended, but due to cost, we are unable to have these therapies for him. So that's a good like kind of snippet to put on your if you decide to do this additional attachment sheet, that's a good snippet to put that, although your child is prescribed all these speech, OT, all these therapies, due to cost, you're unable to do it. Any questions about that? The additional form or paper information form. This is not like required a part of the packet. It's just to highlight your child's medical history a little bit more.
Hi, I have a question. Who prescribes this therapy recommendation? Is it coming from the PT saying how much PT he needs, or is it the primary care physician, or is it a specialist?
So the initial prescriber would be a physician. So this could be like your pediatrician, his neurologist. The the prescription cannot come from like a therapist. It has to be from a physician. So most likely it'd probably be whoever, if it was a developmental pediatrician or their, regular pediatrician, they would have to write a prescription for it. So that's what this is based off.
Do we need to attach that prescription to this?
Yes, I do recommend that. And I think I have a sample. Yeah, I do recommend that because we are highlighting that our child has these recommended therapies, but due to cost, we cannot take them to it. We're highlighting that, showing that to Katie Beckett team, that here, this is prescribed by a trained physician, but unfortunately, we just cannot fulfill the prescription. We cannot do it. So yes, I do recommend that you attach that to the packet for sure.
And keep in mind that the state of Georgia does not want you to know about this information. So you really have to lay it on them thick the first time around. So you will have a high chance of being approved for this.
Yeah, everything has to be very specific. As Christina mentioned, this is an additional resource that the government has, and the government does not. We like to give anything to citizens for free. It's very strict, and the criteria has to be met, or you will be denied. If your child is denied, you can appeal. With an attorney is the best way to appeal. So that's going to cost, of course, but yes, being very specific, being very detailed, over detail is good, so that you have a high chance of approval. All right, next page is a level of care statement, DMA 70706. So this form also needs to be completed by a physician. This form has to be completed by the same physician that does the DMA 6. So the form we just looked at, they have to complete this form. The same physician has to complete this form. So similar to DMA 6, you may want to complete this form for the doctor so that they can just sign it. If they feel comfortable filling it out, they can check it over and fill it out. If they feel comfortable with signing it after you fill it out, just make sure it's consistent with the guidelines. It's calling me. So again, so personal information. So the member name would be your child's name, the demographics. So diagnosis. So in this section, you'll list all the diagnoses applicable to your child with the highest level of need first. So the most severe, the highest level of need first. Let's see. So autism alone does not allow your child to qualify for Katie Beckett. You'll need more specific level of need. So, for example, it could be autism, developmental delay, expressive speech. What is it? A diagnosis? Expressive or receptive speech delay. So it can. So just putting autism is not going to get high approval for it. Let's see. Recommended level of care. I wanted to highlight this. Let's see. So medical history, please see attachment, especially if the attachment that I showed you in the slide before had all his medical history there. So that's why I put please see attachment. If you have space to fill out and put it here, you can. If your child has had any hospital discharge, you can attach it to your packet. So recommended level of care, you should check intermediate care facility. Do you see that? So not checking this one can get you denied. The nursing facility level of care, the first box, that would be checked if your child needs 24-hour nursing care. So that if they had tube feed-ins or they needed breathing support, that would be appropriate to check. And the second option, intermediate care facility, is applicable if your child needs significant level of support, but not 24 hours of care. So a significant level of support would be like behavioral support, speech support, occupational support, feeding support, or feeding therapy. This would be what intermediate care would be. Let's see. What else do I want to highlight here? So current needs, this would be more of an area that you would work alongside your pediatrician or developmental pediatrician to fill out. So these are going to be more medical based. And so for example, for a child who has history of autism or other developmental delay, one of their neurological needs would maybe ABA, speech, OT, feeding. If they are incontinent, for bowel or not potty trained, their current needs would be incontinence based on that. So the therapy sessions per week, this would be an area that you would fill out. Really, you want to, although your child may not have 5 therapies a week, if it is prescribed, put that here. Put how many sessions or how many times a week, a month it is actually prescribed. You're doing this as if your child is in the therapy, if that makes sense. Is in the prescribed therapy. Box, let's see. If their child is in school, if they have an IEP, IFSP, you can attach that. Definitely attach that. Skilled nursing, if this is appropriate. As I mentioned, if your child has feeding tube, or is receiving, has a breathing tube, then that would be appropriate to check off. Otherwise, you can put NA. Any questions about the DMA 706? Oh, and again, do not date. Do not date and put a sticky note, a Post-it telling your doctor, please do not date. You should be the one that date all these forms when you're ready to actually submit. Any questions in the chat? Oh, no chat. Okay. All right. So cost effectiveness form is next. This is the letter of medical necessity. Okay, we switched it. So letter of medical necessity. This is basically the prescriptions. This does not have a form to complete. It's a statement or prescription from your child's physician indicating how the treatment plan or what they're prescribing for your child. So this part does not have, the prescriptions do not have to be from the same doctor who fills out the form. So for example, if your child sees a psychiatrist can recommend ABA so certain amount of times. Then a pediatrician can come and say, hey, I think that your child would benefit from aqua therapy so many times a week. So you can have different prescriptions from different specialists and include it in the packet. And I don't know if you can see okay, yes, awesome. So this is kind of a sample prescription. It has to be very specific. And what I mean by that is make sure that it has, of course, the physician's name, the title, address, phone number. It should say patient prescription on it. It should mention what services, evaluate and treat, and specify the amount of times per week and the increments per week. This is very important. And this also should not be dated. And this can get tricky because the pediatrician may not want to give you a prescription that is not dated. If that's the case, you can ask them to date it a few weeks after you actually have it, so that it's still within the time frame for you to submit your application. But when they do it, please make sure that they're specifying what the therapy is, evaluation and treat, the amount of times a week, and the amount of the increment of time per session. So if your child has like a prescription for OT, speech, and physical therapy, all of those therapies would equal to five therapies a week, essentially, or should equal to 5 days a week. Any questions about that? I do want to mention, again, this is not a form to fill out. These are actual prescriptions that you will need to physically get from your child's doctor. Katie Beckett does ask for the original prescriptions. I do advise that you make a copy to keep for your records, but they will want the physical copy. For those that go to have doctors at CHOA, they have the my chart generated prescriptions. That's considered original. They do not accept any stamps or electronic signature. It actually has to be signed by the physician. All these forms has to be actually signed by the doctor, no stamps. Just FYI. And then the last but not least is the cost effectiveness form. This form should be completed by the same doctor that has completed the DMA 706, the DMA 6 form. There is really no way for the physician to complete this form without any input from you. Specifically, they're going to need information on the cost of care from your medical billing history. So you can get this from looking back at your statements, if you keep a track of your copay amounts for therapy, or a guesstimate. Like, so for example, if you pay $50 a therapy day, and your child goes to therapy twice a week, I mean, that's, $100 a week that you're paying out of pocket, 100, times 4 weeks. So you would so all of that calculates to add up for the cost effectiveness form. So the same thing, you put your child's name. So patient's name is your child's name. For Medicaid number, this is would be your first application. So you can put NA or new application. For the diagnosis line, again, you list the most severe or the most challenging diagnosis first. So for prognosis, Katie Beckett is looking, they want to make sure their money is going to be well spent and effective. So you want to really indicate that the benefits that your child will receive from Katie Beckett will provide improvement in their overall care. So you can actually use my statement here. So blank, your child has significant disabilities or delays. However, quality therapy and treatment, they will make progress. because Katie Beckett is wanting that. They want to give families money to keep our children at home and provide the support and care that they need. Let's see what else I want to point out. For monthly costs, so you'll have to do some digging. There's no wrong way to do this, but you don't want to underestimate. So you have to do some digging on medical bills, insurance reports. So each category, you list approximate monthly costs that if you didn't pay, then Medicaid would have to pay for. And so the Katie Beckett staff will literally plug in these numbers into their system to see if providing your child with support will be more cost effective for the government. So don't overestimate, but don't underestimate either. So be as accurate as you can, definitely. And then on the total, you put your total amount there. Another thing, Katie, I think the maximum amount that Medicaid is paying for a child, I believe, is $100K a month. So when you add up your therapies, I mean, it definitely probably would be hopefully less than $100,000 a month. But this is so Medicaid is literally plugging this in and saying it's cheaper for them to approve your family for Katie Beckett and give you this additional resource than your child is institutionalized and they're paying for $100,000 a month. Someone wrote a question. Let's see. Sorry if it was covered in the first one, but how exactly does income level affect the ability for a parent to qualify? So for Katie Beckett, the child would only be eligible if the parent's income is higher than what is needed to be approved for Social Security. So it does all of these, what you mentioned, plays into account. So it is the parent's income, because if the parent's income is not high enough to be denied Social Security, you're not eligible for Katie Beckett. And in addition, the child also has to have these needs. They have to have, based on the psychologist's report, as well as the number of therapies, they have to have these needs to show that this program is going to be beneficial for them. So it's an interchange. It's kind of all working together. But step one, you have to be eligible for Katie Beckett based on not being eligible to have Social Security. I hope that answered that question. What if your developmental pediatrician only prescribed ABA but not OT or PT? Can we add other referrals and ask them to sign? Of course. So if your developmental pediatrician only prescribed ABA, you can have a discussion with your child's general pediatrician to see if they'll give you prescription for these additional therapies. The prescription does not have to come from the same person that completes the forms. The prescriptions can come from any specialist or multiple specialists. They just have to be a physician. So you can get prescription for neurologists. You can get prescription from psychiatrists, a pulmonologist. So it can be different. It can be different specialists. Apply for the prescriptions. Now, if the ABA is prescribed and it's written, if you go back, Christina, to the medical costs, medical necessity, when they write the prescription, if they're writing behavioral therapy evaluation and treat 5 days a week for 6 hours a session, that's more than 5. That's 5 or more sessions a week. So that is okay to be, for eligibility for Katie Beckett. Even if your child's not getting the additional, speech, OT, PT, all that. So let's see. And then for the cost effectiveness DMA 704, there's a place that says, let me see what it says. Will home care be as good or better than institutional care? Again, we want to put yes, because we want to keep our children at home. And we're saying that ultimately our goal is to keep the Katie Beckett program is for our children to be able to receive care at home versus being in an institution like they would have done back in the day. And even now, some children upon diagnosis are, they do go to institutions. And then comments. So this is kind of like, this is not mandatory. This is just like putting like sprinkles on a cake saying, hey, we really need this. By having this program, it will allow our child to progress. You can also put what your current primary insurance will only cover per year. This you can, learn about this by calling your insurance company. Hey, how much ABA will you pay for a year? How much OT sessions can my child get a year? And that's how you can document how many times a year your insurance would pay for. And just put that in here as a snippet. Not necessary, but just a little sprinkle on top of there. And again, please don't date it until you're ready to submit. So this form is definitely going to be parent dependent. You're going to have to fill this out and really dig deep, look back at receipts to see what you spend each month on your kids' therapies, or even physician services. That would be copays. So if your child is like mine and has like asthma and allergies, you go to different specialists each month. Those are copays every month. Every time you go to the doctor, those are copays that you have to pay. Durable medical equipment, that would be like if your patient is on like tube feed-ins or breathing tubes or machines, and they utilize those, and you put that. Drugs, so any prescription medications that I ever had to pick up from the pharmacy for my son, I put that there, the copay of the prescription medication. And so therapy, this is private therapy. This is monthly copay amounts, all this adding up together. And diapers or pull-ups, if your child is still utilizing those, how much do you spend a month on diapers or pull-ups? So put that amount there.
Kenzie has a couple questions in the chat.
Oh, okay. So I have like 3 screens, so let me look over here. At what age should be? Yes, this is the correct age. Definitely at 3. On one of the pages, it says, let me look back and see. I think it says age incontinence, age dependent incontinence 3 and older. So definitely now, if your child is not potty trained yet, Kinza, definitely put the cost of the pull-ups or diapers that you're ordering. It supplements by Helix. Yes, definitely. Yes. And I would also put the supplements under the medications that your child is taking. But yes, supplements can be a part of medications. I mentioned vitamins. If I give him, the kids one a day and melatonin, you put that on there. All right. I think, what's the next slide? Okay. So, so step 1, we reviewed, months ago, gathering information, filling out the personal forms, getting medical records. This is step 2. This step will take you probably about 2 months, 60 days, or maybe I would say 45 to 60 days, dependent on the pediatrician. Do they charge you to do the forms? Do they want you to have an appointment to do the form? So that's why I say up to 45 to 60 days to fill these out. So this is step 2, and then next step 3, we'll put them all together and see how we can do the pack. How you put your packet all together will be our next presentation.
If you have not seen part 1, make sure you go to part 1 because you'll be missing some important information if you just start from this webinar. And that could be found at shineautism.org/webinars.
All righty. Any questions? Q&A.
No, I just wanted to say, being like a provider that works with Medicaid, you guys are doing some good work here. You made us sound really smart when we went to an event with the YMCA. Yesterday, I told quite a few people and other businesses when they had questions about Katie Beckett that they should check out the Shine website because they're building a guide for it, and I was able to answer questions because of some of the stuff that we went over in that first meeting. So I appreciate what you ladies are doing. Yeah, no problem.
Yeah, I think it's definitely important for us to, once we find information, to share it and not monetize it, which many people have done. But this program is available, very limited states, but it's available to us in the state of Georgia, and we need to take advantage of it. And I didn't mention, in the first session I mentioned, but maybe help Ms. Delancey and Kinza, that once you're approved for Katie Beckett, you actually will start getting reimbursed for your premium, your insurance premium, your private insurance premium. So every month, for example, if your insurance premium a month for your family is, I don't know, $500 a month, you will actually get a check back for that amount. So you're getting money back is always like Christmas. So that's,
is there a form that you fill out, or will that just be because you completed the application?
So after next month or whenever we're doing part 3, we'll put it all together. But a part of your form, there's an application called HIP. It's going to be a part of like your personal initial forms, and you would submit that all together, and Katie Beckett will automatically send it to that unit on your behalf after you've been approved. You have to be approved first before you get that.
Awesome. Thank you.
Mm-hmm.
There was a question asking how soon do you get feedback once you submit the application?
Oh, yes, I did mean to look at those questions and go over it. How long does it take for the application approval?
No, how long does it take for you to get notified after you submitted?
So it is the government. So expect 4 to 6 weeks. Now, if you hand deliver it, I think I mentioned this before. I mean, it is easier to, put it in the post office, whatever, UPS. But if you hand deliver it to the person, it is a much faster. It could take like 3 weeks if you hand deliver it to someone. You hand deliver it and then wait a week and call to see who your case manager is, and it works pretty quick. As you know, and you call in consistently each week, it works pretty fast. But I would say at standard, it's been about 4 to 6 weeks after they've received your application. how do we go about getting Katie Beckett to pay for supplements? So are you talking about like nutritional supplements or like vitamins? Well, I guess it wouldn't matter. Oh, nutritional. I guess it wouldn't matter. Because as you have a so let's say your baby gets Pediasure vanilla. I don't know. Your pediatrician or the physician has to write the prescription for Pediasure vanilla one can every day. You take that to a pharmacy, and the pharmacy will fill it and bill the Katie Beckett Medicaid waiver. So that's the only way it will be processed. It has to be billed to. It's kind of like if you took your insurance, you went to a pharmacy for medication, use your insurance, and it bills your insurance. It's the same thing. You have to have a prescription. It has to be filled at a pharmacy for it to be paid. There's no reimbursement with Katie Beckett. Like, they're not going to reimburse you for a medication that you've already paid for or a therapy you've already paid for. It's more like it has to be billed. The only reimbursement you'll get is for insurance premiums. How long does the process take? An application is one of the questions from the webinar. The application process, if you're doing it yourself, it can take about 4 months. If you hire someone to do it, it's probably about 30 to 60 days. If you're hiring, like, some of the people that are well known to do it. Where do I go to apply? The link, I think I posted it here. All the forms for the application are on the Medicaid. All the forms that you need for your packet are on the Medicaid.gov site.
And in the chat.
Oh, in the chat. Are there any other questions I should answer from this list?
Can you go over number 4?
Oh, my son had Katie Beckett and it just expired 8 months ago. How can we get it back? He needs to, he goes to public school, so his only therapy outside of school is music therapy. So you'll have to reapply. So the child will have to just, I guess, rewatch the part 1. You kind of have to just go back and do, entire application process again. And making sure that the developmental the psychologist evaluation is up to date. Making sure that even though his only therapy right now is music therapy, having prescriptions, if necessary, for additional therapy can be submitted. And still, like how I listed on one of the forms, that due to cost, we're unable to take our son to these therapies, but these are the therapies that are prescribed. So having documentation like that, can potentially allow you to get approved, but you have to do the process, unfortunately, again, because I do believe that there's a renewal period, but I believe because it's 8 months ago, you're outside the renewal period. So it's kind of like starting all over.
Can you also slide in number 5 and number 6?
Yeah, I'm looking.
That'll be it.
This is the one that I was saying I was going to get from Marcus. Let me see.
Oh yeah.
What is her name? Let me look at it. Oh, here it is. Her name is Cynthia. The question is, I am seeking advice on how to proceed with obtaining a formal medical diagnosis for my daughter. She has been diagnosed with a condition through her school, but this diagnosis has not been confirmed by her physician. Although her medical records include this diagnosis, we have not received an official medical confirmation. And I wanted to share with that person, I'm not sure if they're in here, but there is actually a study going on at Marcus right now for that includes an evaluation by a physician. The study is a genetic study, and I mean there's criteria and such, but it is a free way. They don't bill insurance. They don't expect any payment from the parents. But I wanted to post the contact here, the email. And the name of the study is, it's just called Autism Genetic Study. That's the name of the study. Yep. That's the name of the study. And it is at Marcus. Once you're approved, Brittany, it's really interesting how it works. So you're approved, and then 6 months is kind of like a check-in. And Katie Beckett is like, hey, are you still needing us? So you do like a 6-month renewal. And then after the 6-month renewal, if everything is okay, then it's good for another year. So you still have to do a renewal. And so it's called like at 6 months, it's called a short renewal. And how that would look, they're asking you like demographic, has anything changed with your income? What else do they ask? Has anything changed with your private insurance? They don't ask about therapy, if I remember. It's just kind of like demographic stuff they ask about. And then the year renewal is the whole thing. You'll need notes again, and therapy notes. So the year is kind of the larger renewal. But your child can be on Katie Beckett until they're 18 years old.
And the last thing I want, will you have to see developmental peds yearly for the renewal? That's a great question.
Well, you have to see, for the renewal, do you mean like you don't have to get a reevaluation? The psychological report has to be every 3 years. So it depends on the timing. So if your child's the initial autism diagnosis report that you would have received, that has to be dated, within 3 years. So it depends on the timing. So if by that year it's been, over 3 years, yes, you'll have to get another evaluation. And the psychological evaluation does not have to be done by a pediatrician, a developmental pediatrician. Katie Beckett will accept an evaluation from a psychologist.
Okay, go. Turn it down. So Stephanie, how are you organizing all of this paperwork?
How do I organize all of this?
Yes.
Oh, I told you earlier, I have a Dropbox. And so anytime I get any records, especially when my child was in ABA records could be like over 400, 500 pages. And I literally just scan them into a Dropbox, to my Dropbox. And so even now, as I've just finished the short renewal, and so I'm going to prepare ahead of time for the long renewal. So I always ask for therapy notes. So every 3 months, I'm asking for therapy notes just so I can have it, in the Dropbox. So keeping it organized that way, if that works for you, or if you're a paper person, just printing it and having it in a large folder or binder, to try to keep it all together.
Okay, so digitally, and you have physical copies as well.
Yes. I'm sorry. The question is how to organize the documents for the Katie Beckett. I thought you were asking me how I organize.
That too.
So for the Katie Beckett, I think it's very easy to work in the parts. So like how in part 1, we talked about, doing the personal forms, and go ahead and get in the therapy notes, as much as you can together. And then now part 2, you focus on getting the physician notes together. And then part 3 is kind of putting it all together, creating your application packet, making sure everything is dated within that 90-day time frame. So really maybe following the parts by section would be good, so you're not so overwhelmed. Because this can take 4 or 5 months to do it all. So
Okay, and Jason had another question. If your child is in school and getting an IEP, I believe the FBA that has to go along with that is yearly. So would that work for any renewals?
what is FBA? I'm not familiar with that.
Yeah, what that is.
Functional behavioral assessment.
Is it
I thought you had that.
psychologist?
Yeah, or BCBA could do it.
No, not BC. The title has to be a psychologist. Let me see. Let me go back.
Or
psychologist, physician.
Okay, a psychologist can do an FBA.
Yes. Yeah. So if for the FBA to be like appropriate for your packet, it has to be by people with those credentials. So a psychologist or a physician. The BCBA would not accept unless it's a BCBA with a like a PhD psychology. Some BCBAs have that too.
Oh, okay, yeah, that's interesting because when you're doing the gap assessment for behavioral, your FBA that's done yearly that goes to your IEP, they're usually sending you towards a BCBA. So that's why you can. So a lot of the clinics, like a lot of ABA clinics, can do FBAs. But yeah, if you have to some of them have psychologists because we partner with a few, and one of them has a psychologist and the other one doesn't. So that's something to keep that in mind.
That's good to know. I never heard of FBA before.
I wrote that down. Okay, how do y'all feel about all of that information?
Yeah, let me copy and paste the credentials that can qualify, or should I say the evaluation. Let me so it says developmental pediatrician, psychologist, PhD. Oh, where's my pointer thing? Oh, it's gone. Oh, here it is. And one more. Yeah, BCBA is not listed here. But I guess if they have any of these credentials, then they definitely would be able to. But medical notes, do you put all pages like some medical? Oh, yes, definitely, Kinza. The package will be probably about 400, 500 pages. That would not be out of the ordinary if the packet was 400, 500 pages. Like your entire packet. No problem.
Okay, do y'all have any more questions or thoughts, concerns?
If
It's
you
all
have,
set.
I am available. You can email Christina, and she'll connect with me, and I will we can set up a call, or if you want me to review what you have so far, I'll be happy to do that. But connect with Christina, and then she'll get with me.
Yes, I'm doing that email right now. So the email I will send out to you guys will be the link for the physician forms, the link or the contact information for the autism genetics study at Marcus, which would be a loophole if you do not have a diagnosis. So that'll be a quick, cheap way to get a diagnosis if you do not have one. And the information for part 1. Part 2's recording will probably take like an hour to upload to the cloud. So I can include that information in the email as well. So be looking out for an email from me either tonight or in the morning.
Hi, quick question. I'm sorry, you were breaking up on my end.
Okay.
When you mentioned the quick diagnosis, what do you mean by that?
Quick diagnosis.
Marcus, they're having a genetic study. So with that study, they're offering a diagnosis. So that'll be a quicker way for you to get a diagnosis versus being on a waiting list for years.
Awesome. Thank you.
You're welcome.
Yeah, there's currently a study that's going on. It's no cost to the family. And within the study, they're also conducting evaluations, and you will be able to utilize that evaluation as, like toward your package. It's a professionally done evaluation by a physician on their team. So
I think that's great that they even have that, but I know it's not advertised either. Oh yeah, you mean my information, Kenza, or Stephanie? Well, you'll have both anyway. Okay, gotcha. Okay, ladies and gentlemen, if you don't have any more questions, that's it for our presentation. Please, please, please come back for part 3. Stephanie does an amazing job at explaining all of this thoroughly, and I'm just grateful that she even knows all of this knowledge, because this knowledge does cost a lot of money in Georgia. And I think $1,500 is the low end, because I've seen $800 for.
Oh no, $2,300. There's a lady.
Wait, what? You said 3,300?
No, 2,300. I went to my pediatrician for her to I was asking her about something, I don't remember, and she gave me a flyer with, I think her name is Gina or something. Anyway, she's charging $2,300 to do with Katie Beckett.
You paid $2,500.
No, not me. No,
Kenza did. She just put that in.
Oh, yes. The diagnosis is very, yes. Insurance seems to not want to pay for it. I don't know. And if somebody does accept insurance, the wait time is like a year, 8 months to a year. So sometimes you do have to go ahead and pay out of pocket. Like, Kenza, did you go to Dr. Rubin? Oh, okay. Dr. Rubin charges. Dr. Sindhu is the neurologist. Inspire Neurology. Is she Inspire? Yes. Yeah.
Mm.
Yeah, she's the neurologist.
That's an expensive piece of paper.
Oh, Dr. Rubin covered. Oh, that's great. Oh, insurance covered Dr. Rubin. Dr. Rubin, I think he's gonna retire soon. he's getting up there.
Oh my gosh.
Well, Dr. Sindhu is out of pocket. She doesn't accept insurance.
I see why they don't. No one wants to be bothered with insurance.
And Dr. Rubin accepts insurance at CHOA, CHOA by Grady. I forgot the name of that one. That CHOA.
Ingleston.
I think it's that one.
Eggle.
There's another there's a psychologist that does it. She actually does Katie Beckett specific. Let me see what's her name. What is her name? Oh goodness. What's her name?
I don't think this would be worth paying money for because it's so much of your personal information on these papers. But I mean, I'm not discouraging someone to go have the service done, but that's a lot of information.
Dr. Palouse, Dr. P accepts insurance, and she does do Katie Beckett specific evaluations, like with all the diagnostic testing on there.
Wow. Mind is blown. I just looked at her website.
Is that
Yeah, that's funny. That's really funny if that's the same, Gina.
No, I don't think that's the person. I don't think that's her. The $2,300.
Yeah.
Let me see what doctor is. What she sent me. I don't think that's her. I know, Debbie is obviously very popular.
Oh yeah. My God. Yeah, we gotta keep some money in your pocket.
The greatest thing is when you get the HIP, well, not the greatest thing, but the extra spending money when you get the money back for the insurance. The HIP sends you money back. It's like, oh, I got a check in the mail.
Reimbursement. Oh, didn't you mention on part 1, you mentioned something about the reimbursement, and I think it was about if you have a family insurance, you get the reimbursement for the whole family?
Yep, it pays for the families. The child has to be on it.
Mm-hmm.
The child who you're applying for Katie Beckett for has to be on that insurance. But if you have a family insurance, you and your other children or your partner are on one plan, yes, they'll pay for the actual plan. Or reimburse, excuse me, not pay for, but reimburse.
Kenza said, oh, you mean, are you getting, is your reimbursement the premium or the deductible?
The premium. Katie Beckett actually pays your deductibles if really they're paying your deductible because how I saw it or break it down, when you're going to the doctor, you no longer pay co-pays. And if you have like my son had to have the x-rays, and that usually would have to, go to a deductible and whatever. but I did not have to pay a deductible because the Katie Beckett Medicaid waiver kicked in and took care of that deductible. So his x-ray, I didn't have to pay anything for. So you end up not having to pay copays, and your deductible is basically met because they'll cover it. If we pay $1,000 deductible already this year, I'm not sure. I understand. What do you mean? Are you saying that? Are you asking if Katie Beckett would reimburse it? No. So Katie, the only reimbursement that you would get if let's say if you were approved December this year, you would get reimbursed for the previous 3 months from a provider that is able to accept Katie Beckett. So in real life terms, what that means, let's say for speech therapy. Uh-oh, my screen disappeared. Am I still on?
Yes.
Oh, okay. So for example, for speech therapy, let's say speech therapy accepts Katie Beckett or straight Medicaid, which is also what it can be called. If the provider accepts straight Medicaid, Katie Beckett, and your child is approved on December 1st, that provider is able to bill Medicaid for 3 months before December 1st. So you would then be reimbursed all the payments that you've ever paid for that speech therapist for the 3 months prior. Does that make sense? But Katie Beckett's not going to give you money for the deductible. Okay, yeah. I'm trying to find that lady that was charging the $2,300, but I can't find her name. Oh, here she is.
Good night, ladies. Thank you.
Bye-bye.
Thank you.
Thanks
Good
for
night.
watching. Here she is, Jason. I'll copy and paste. Maybe you can see what her services are. Oh, Jason signed off. Oh, here she is.
Paste it anyway.
This is her. This is the person.
Okay. Okay. Yeah, I think did my other thing leave?
Help Them Grow is the name of her company. Yeah. But this was in when I inquired with, my pediatrician gave me her flyer in July 2023. They sent it to me. So wonder how much it is now.
You said Raise Them High?
Oh, the name of her program is Help Them Grow.
Okay. Yeah, so this.
All right. Well, I hope if I can be of any help to any of you, I would be happy to help.
Thank you guys for hopping on, and thank you, Stephanie, for your knowledge and your area of expertise, and thank you for being the sacrificial lamb.
Thank you all.
Oh,
Thank
no
you,
problem.
Jason.
See you next time.
Ken, do you have any more questions?
No, I'm good. Thank you so much, guys. Really appreciate it.
You're welcome.
No problem. Have a good evening.
Okay.